Good afternoon. Today I want to talk about the drug atenolol, what it's used for, the side effects, who shouldn't be taking it, the repurposing of the drug, and the effects it has on the environment around us. Atenolol is a beta blocker medication. This drug was first approved in the United States in 1975. It is the 53rd most commonly prescribed drug in the US. This drug helps prevent high blood pressure, heart attacks, or a second heart attack if you've already had one but didn't catch that. It can also regulate hyperthyroidism, long QT syndrome, which is like the relaxing of the heartbeat, irregular heartbeat, um, fast heartbeat, known as SVT, when the upper chambers of the heart beat really fast. And then there's also the lower chambers of the heart, which is called ventricular tachycardia. So you might ask what a beta blocker is. I had the same question whenever I first heard about the drug. Upon doing some more research, I found that it's any drug that blocks the receptor sites for the adrenaline or noradrenaline on the androgenic beta receptors of the sympathetic nervous system. So, in other words, upon more investigating and more research, this ties in with the mammalian response of fight or flight. Um, a good example of this is like right before you take a test, you might have anxiety, elevated heartbeat, or for example, like I am about to get pulled over by the police officers and I just know I'm going to have a ticket coming or there's going to be an inspection. It's just a response, fight or flight, elevated heartbeat, things of that nature. Some of the common side effects of atenolol are dizziness and fatigue, low blood pressure, difficulty breathing, sexual dysfunction, wheezing, drowsiness, nausea, vertigo, and leg pain. There's also allergic reactions like rash, itching and swelling, severe dizziness, and trouble breathing. At this point, you should contact your doctor if you have any of these allergic reactions. If you have some of the severe side effects that could be deadly, heart failure, slow heartbeat, cold fingers and toes, or mental and mood changes, these are some of the more severe side effects. Listed below is the atenolol IUPAC name, the molecular formula and weight and the boiling point. Repurposing of the drug atenolol. Atenolol can potentially be repurposed to inhibit pancreatic cells. In one of the journal entries that I read, atenolol-mediated proteins, AMPs, were collected from direct target proteins, DTPs, and indirect target proteins, ITPs. A docking simulation and ligand protein binding visualization were generated by molecular operating environment software. The molecular docking study revealed that atenolol inhibits MMP9 and NKB cancer signaling cells. Patients with chronic kidney disease and atenolol. Atenolol is recommended in lower doses if a patient has chronic kidney disease, as atenolol can cause further damage to their kidneys and they would possibly have to start dialysis, or it may even lead to death. Atenolol is safe for the environment, but the same cannot be said for other beta blockers such as propanol. Atenolol is excreted in urine, but only about 50% of the dose is used in the body. The other 50% ends up in the sewage and surface waters. Atenolol showed considerably lower toxicity than propanol. Propanol is 50 times more toxic to planktonic crustaceans and 1,000 times more toxic to green algae than atenolol. So you can't categorize all beta blockers being bad for the environment in the public water. Based on the research I've done over the last couple of weeks, I feel like atenolol is extremely safe, good for the environment, and affordable. As of 2020, more than 3 million Americans were prescribed this drug. Just be honest with your doctor and pay attention to any side effects or allergic reactions, as it can get deadly. Along with weight management, regular exercise, and low salt and low fat diets, along with the atenolol, you can reduce the risk of heart attack, stroke, and lower blood pressure.